Most people over 65 are told the same thing. Take your vitamin D, add a fish oil, maybe a magnesium at night for sleep. It sounds sensible, it sounds safe, but here is what nobody tells you. Those three, on their own, do not protect your independence. Roughly 1 in 3 adults over 65 falls every single year, and clinics see the same picture every single day. A drawer full of bottles, a person who has taken them faithfully for a decade, and that same person cannot rise from a low chair without pushing off with both hands. The bottles were never the problem. The ranking was. So today I am ranking 5 of the most common supplements for people over 60, from least useful to most useful. Exact dose, exact timing, and the mistake almost everyone makes with each one. Along the way, I will give you the one thing a 12-minute appointment never has time to cover. The number one item on this list is something almost nobody talks about for people your age. Stay with me until the end, because that one can change how you approach the next 10 years. Here is why nobody has ever ranked these for you. The average appointment runs about 12 minutes. In those 12 minutes, your doctor has to review your medications, check your blood pressure, read your labs, and deal with whatever brought you in that day. Prevention is what gets cut. Not because your doctor does not care, because there is no billing code for a 20-minute conversation about which supplement actually keeps you standing. So you get the short version, take your D, get a little sun, slow down, and you walk out with a plan that keeps you alive but does not keep you upright. I am not here to sell you a supplement or scare you into a course. There is no product line, there is no link below this video. This channel exists to give you the science a 12-minute appointment never has time to cover, and understand what is actually at stake. This is not about living to 90. This is about whether you get off the toilet by yourself at 85, whether you carry your own groceries up 3 steps, and whether you stay in your own home instead of someone else's. Before we start, tell me in the comments how many supplement bottles are sitting in your cabinet right now, just the number. I want to see it. Now please do not skip this section. It is the key to everything that follows. Every supplement on this list does one of 3 jobs. Once you see which job each one does, the ranking becomes obvious. Think of your body as a small-town water system. There is a reservoir, which holds the raw material, there are pipes, which carry it, and there is a pressure pump, which forces the water uphill into the houses. You can fill that reservoir to the brim. If the pump is weak, the water never reaches the top floor. As we age, the pump weakens. Scientists call this anabolic resistance. In plain language, the muscle stops answering the door. It used to respond to a quiet knock. Now it needs a much louder one before it will build anything at all. Almost every supplement people over 60 take is filling the reservoir. Almost none of them touch the pump. That is the whole problem in one sentence. If this is already making sense to you, tap the like button. That one tap is what puts this ranking in front of the next person who is quietly struggling to stand up. At number 5, magnesium glycinate, not magnesium oxide, which is the cheap form in most drugstore bottles and mostly buys you a trip to the bathroom. Magnesium is a valve. More than 300 enzyme reactions in your body need it to open. In our water system, it lives in the pipes and controls the flow. Your nerves use it to settle down after they fire. Your muscles use it to let go after they contract. When it runs low, the valves stick. That is why low magnesium shows up as night cramps, restless legs, and shallow sleep. Large population studies have consistently found that a substantial share of older adults take in less magnesium than recommended, and absorption falls with age, so what you swallow and what you keep are 2 different numbers. Here is the protocol. 200 to 400 milligrams of elemental magnesium as magnesium glycinate about 1 hour before bed. Start at 200 milligrams for 2 weeks. If your sleep improves and your stomach is calm, move up to 300. Glycinate is the form because glycine itself is calming, and it does not pull water into your bowel the way oxide and citrate do. The mistake almost everyone makes is reading the front of the bottle. A label shouting 1,000 milligrams of magnesium glycinate may contain only 140 milligrams of actual magnesium. Turn the bottle around and find the words elemental magnesium. Now the safety. If you have kidney disease, do not take magnesium without your doctor's approval because your kidneys clear it and impaired kidneys let it build up. If you take a diuretic, a heart medication, or certain antibiotics, talk to your doctor before adding anything because magnesium can block absorption of some drugs, and if you get loose stools, you have gone too high. Drop back to 200 milligrams. Loose stools means stop, not push through. Pair magnesium with vitamin D, which is next on this list. Your body needs magnesium to convert vitamin D into its active form. Taking large amounts of D on low magnesium is like ordering more water for a system whose valves are stuck shut. But here is what magnesium cannot do. It cannot build 1 single gram of muscle. It maintains the machinery you already own. Which brings us to the one bottle almost every person over 60 already has, and almost nobody understands. At number 4, vitamin D3, at 1,000 to 2,000 international units a day, not the giant 50,000 unit capsule, not the once-a-year injection. Vitamin D is not really a vitamin, it is a hormone, and its job is the permit office. It gives your gut permission to absorb calcium. It gives your muscle cells permission to answer a signal properly. Without it, the raw material arrives at the site and gets turned away at the gate. That is why true deficiency shows up as weak legs and an unsteady walk, not only as thin bones. Here is what large trials have consistently shown, and it surprises people. In older adults who already have adequate vitamin D levels, adding more does not reduce fractures and does not reduce falls. The benefit lives almost entirely in correcting a real deficiency. So, the protocol. 1,000 to 2,000 international units of vitamin D3 daily, taken with the largest fat-containing meal of your day, because D is fat-soluble and absorption roughly doubles when fat is present. Ask your doctor for a 25-hydroxy vitamin D blood test now, and again after 3 months. Most guidelines converge on a blood level of at least 30 nanograms per milliliter. The mistake here is megadosing. Trials using very large single doses, 50,000 units or more at a time, have reported more falls, not fewer. More is not better with this one. More is a different drug. Safety. If you have sarcoidosis, kidney stones, or high blood calcium, do not supplement vitamin D without your doctor. If you take a thiazide diuretic or digoxin, ask first. Nausea, constant thirst, and confusion are the signs you have gone too far. Those mean stop and call your doctor, not push through. Pair D with the magnesium we just covered, and with weight-bearing movement on the same day. D signs the permit. Magnesium activates it. Standing and walking tell the bone where to send the calcium once it is through the gate. But notice what D has still not done. It has not laid a single brick. It only signed the paperwork. So what actually clears the rust out of the pipes? That is number 3. And I will tell you now, it is still not the winner. The number 1 supplement on this list beats everything you have heard so far, and I will show you exactly why. At number 3, omega-3 fatty acids, specifically 2 grams of combined EPA and DHA per day, not 2 grams of fish oil. Read that again because that difference is the entire item. Chronic low-grade inflammation is the rust inside your pipes. It never bursts anything. It narrows everything quietly over years. EPA and DHA get built into the walls of your cells and change the signals those walls send. Less rust, cleaner signal, and there is a second effect that matters more for you. Omega-3 appears to make aging muscle a little more sensitive to the building signal. It turns up the volume on the knock at the door. Controlled trials in older adults have found that 6 months of omega-3 supplementation produced measurable gains in muscle volume and grip strength compared with placebo. It is not dramatic, but it is real, and very few supplements can show you that finding at all. The protocol: 2 grams of combined EPA plus DHA daily, taken with a meal. Now turn the bottle around. A typical 1,000 milligram fish oil capsule contains only about 300 milligrams of actual EPA and DHA, which means you would need 6 or 7 capsules, not 1. That is why most people feel nothing from fish oil. They have been taking 1/7 of a dose for years. Buy a concentrated product where 1 or 2 capsules deliver a full gram each, and give it 3 months before you judge it, because that is how long it takes to change the composition of your cell membranes. safety, and this one matters. If you take a blood thinner such as warfarin or apixaban or even a daily aspirin, talk to your doctor before starting omega-3 because it can add to the thinning effect. If you have surgery or a dental procedure coming, tell them you take it. Unusual bruising or bleeding gums means stop and call your doctor. And if you get fishy burps, keep the capsules in the freezer and take them with your largest meal, never on an empty stomach. Pair omega-3 with the protein meal we are about to discuss. Taken together, the effect on muscle looks larger than either one alone. Rust-free pipes, plus actual raw material arriving, but omega-3 still cannot supply the bricks. It only makes the wall better at accepting them. So now we reach the two items that genuinely build, and this is where your cabinet is almost certainly empty. At number 2, whey protein isolate, 25 to 30 grams per serving. If dairy does not agree with you, a pea and rice blend at 35 grams does the same job. This is the water in the reservoir. Protein is not fuel. It is the physical material your muscle is made of, and inside it sits one amino acid that acts as the doorbell, leucine. Aging muscle needs roughly 2.5 to 3 grams of leucine in a single sitting before it will even come to the door. Below that threshold, a meal maintains you. Above it, a meal builds you. That is anabolic resistance in practice, at your kitchen table. Research groups have consistently shown that older adults need a larger protein dose in one sitting than younger adults to trigger the same building response. And most people over 60 eat almost all of their protein at dinner, which means they press that doorbell once a day, at best. Here is the protocol. 25 to 30 grams of protein at breakfast within 1 hour of waking every single day. 1 scoop of whey isolate in water takes 90 seconds and delivers about 2.5 grams of leucine, which is exactly the doorbell. Then 25 to 30 grams again at lunch and again at dinner. That is 3 presses a day instead of 1. The mistake is adding a shake at bedtime as an afterthought while breakfast stays toast and jam. Breakfast is where the gap is biggest, so breakfast is where the gain is biggest. Across the whole day, aim for roughly 0.5 gram of protein per pound of body weight. Safety. If you have chronic kidney disease, do not raise your protein without your doctor's direct guidance, because that number changes completely for you. If you are on dialysis or have had a transplant, the same rule. Start with 1 scoop, not 2, and drink an extra glass of water with it. Bloating or cramping means back off and change the form, not push through. Pair every protein meal with movement inside the next 2 hours. A 10-minute walk after breakfast, or 5 sit-to-stands from a kitchen chair. Movement is what tells your body where to spend the material you just delivered. So now we have the water, and we have clean pipes. But remember what I told you at the start. Everything so far has been filling the reservoir. Not one item on this list has touched the pressure pump. Number 1 is the pump. It is the cheapest, most studied, and most ignored compound in this entire category. Number 1 is creatine monohydrate. 3 to 5 grams a day, plain, unflavored, with no loading phase. I know exactly what you are thinking. That is what the young men at the gym take. And that is precisely why nobody has ever told you about it. This is the loop I opened at the start of this video, so stay with me. Here is what creatine actually is. It is not a hormone, it is not a steroid, it is a compound your own body already manufactures and that you already eat, about 1 to 2 grams a day in red meat and fish. Your muscles store it as phosphocreatine, and its job is the pressure pump. When you stand up out of a chair, the first 2 or 3 seconds of that effort do not run on food and do not run on oxygen. They run on a tiny reserve of instant energy sitting inside the muscle. Phosphocreatine is what refills that reserve in seconds. Low stores mean the pump hesitates. And hesitation in a 78-year-old rising from the toilet at 2 in the morning is the whole difference between standing up and going down. This is not fringe. Creatine monohydrate is one of the most studied supplements that exists, with hundreds of controlled trials and decades of safety data behind it. Analyses pooling trials in older adults have consistently found that creatine combined with resistance training produces greater gains in lean mass and strength than the same training alone. There is also emerging work on cognition in older adults, though that evidence is younger and I am not going to oversell it to you. The protocol: 3 to 5 grams of creatine monohydrate powder, once a day, every day, including days when you do nothing. Skip the loading phase entirely. It was designed for athletes in a hurry, and it is the main reason people get an upset stomach. Stir it into warm water, coffee, or your morning protein shake. It will not fully dissolve in cold water, and that is normal, not a defect. Timing barely matters, so take it whenever you will actually remember it. Consistency is the entire protocol because it works by slowly saturating the muscle over about 3 to 4 weeks. The mistake is buying a fancy version. Creatine hydrochloride, buffered creatine, liquid creatine. None of them have beaten plain monohydrate in trials, and they cost 3 times more. The ingredient list should say creatine monohydrate and nothing else. And here is the part that matters most. Creatine without resistance work is half a dose. The pump needs something to push against. Now the safety, and I want you to hear this precisely. If you have kidney disease or reduced kidney function, do not take creatine without your doctor's approval. In people with healthy kidneys, decades of trials show no kidney damage. But creatine does raise blood creatinine slightly, and creatinine is a number your doctor reads to judge your kidneys. So tell your doctor you take it before your next blood panel, or you will get a frightening phone call that means nothing at all. Drink 2 extra glasses of water a day, and do your resistance work seated or holding a kitchen counter, never freestanding at the start. Sharp pain means stop, not push through. Pair creatine with 2 things. First, your morning protein, in the same glass, because the raw material and the pump belong together. Second, and this one is not optional, 2 sessions a week of resistance work. Sit to stands from a dining chair, 10 repetitions, 3 rounds. Wall pushes, 10 repetitions, 3 rounds. That is the whole prescription. So here is why this is number 1, and why almost nobody talks about it for people your age. The industry markets it to 25-year-olds. Your doctor has 12 minutes. And so the cheapest, most studied compound we have for holding on to the raw power to stand up is being sold to the one group of people who need it least. Balance is not luck. Mobility is not genetics. Independence is trained. Creatine does not train it for you. It gives the pump enough pressure to make your training count. Consider a typical case documented in the rehabilitation literature. A 74-year-old woman, a retired teacher, living alone in a 2-story house. She had taken vitamin D and fish oil faithfully for 9 years. Her bone density scan was acceptable. Her blood work was unremarkable. And she had stopped going upstairs 4 months earlier because she had to haul herself up on the railing and rest at the top. Her family had started using the word assisted. The protocol was not complicated. 25 grams of whey protein at breakfast, a meal she had never eaten in her life. 3 grams of creatine monohydrate in the same glass. Her fish oil raised from 1 capsule to a concentrated 2-gram dose of EPA and DHA. And sit to stands from a dining chair, 10 repetitions, 3 rounds, twice a week. 12 weeks later, she climbed her own stairs without touching the railing. Her grip strength improved measurably. Her 30-second sit to stand test went from 8 repetitions to 13. Nothing about her bone scan had changed. Everything about her pump had. So here is exactly what to do. 5 steps, and every one of them has a number in it. Tonight, turn every bottle in your cabinet around and read the back label. Find the words elemental magnesium and find the combined EPA plus DHA number. If your fish oil has under 500 milligrams of combined EPA and DHA per capsule, you have been swallowing a decoration. Tomorrow morning, get 25 to 30 grams of protein inside you within 1 hour of waking. That is 1 scoop of whey isolate in water, not toast. This week, buy plain creatine monohydrate and take 3 grams a day, every day, in that same morning glass. Give it 4 full weeks before you judge it. This week, start sit to stands from a dining chair. 10 repetitions, 3 rounds, on 2 days that are not next to each other. Hands on the counter if you need them. And within the next month, ask your doctor for 1 blood test, the 25-hydroxy-vitamin D test, and ask for the number, not just the word normal. At that same visit, Tell your doctor you have started creatine, so your creatinine result gets read correctly the first time. Think of someone in your life who has a cabinet full of bottles and still cannot get out of a low chair without a push. Send this to them. It may be the only ranking they ever get. Tell me in the comments which of these you are starting tonight. Your answers decide exactly what I cover next, and if you want the science that a 12-minute appointment never has time for, subscribe. That is the entire reason this channel exists. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Kenji Vance. Don't forget to subscribe and live longer.